Welcome to our Thursday USMLE Prep live session where we go over last week's question that we posted on social media to go over just a little bit of how we will think towards these questions, analyze them, break them down, and then ultimately talk about what is the correct answer and a little bit of why that is. So we are joined, as always, with our amazing Dr. Roland Sang. How are you today?
Doing well. Thank you for having me back. I was kind of surprised you want me to come back, but thank you for having me.
You're great. You have a great time, and you're always very in depth with all your answers. We love to see it. So, as always, if you guys have any questions about the last week's question, if you want to input anything into the conversation, please comment in the area below, and we'll be sure to answer your questions. So without further ado, let's go to this week's question, which was an ethics-based question. That took a minute. Do you want to go for it, Rob?
Yeah, absolutely. So once again, happy Thursday. Welcome back. So today we're talking about ethics, which is a very different flavor than what we traditionally do, like a UWorld style question of pathology, physiology, pharmacology, what have you. But ethics, I think, is a very important topic, and I'll go into more detail why I think it's important. But I feel like ethics is something that a lot of students kind of take for granted. Oh, just do the right thing. How would you act in that situation? If that was true, they wouldn't put this into a NBME or step one question. So the questions you will see are trickier, could have multiple correct answers. So hopefully today, after today's lecture, you'll have a few more resources to tackle them on your own. So once again, we're talking about ethics today. I took the liberty of including this piece of fragment.
What is that?
It's a piece of the Hippocratic Oath. So,
oh, wow.
Thou shalt not do no harm. Thou shalt not, I don't know, cut into someone who doesn't need to be cut. It was actually made in 275 AD. So almost 2,000 years ago, we're talking about ethics. Now, I thought that's fascinating. So anyway, today we're talking about ethics. We have the legendary Megan, and I am Roland.
And I am Roland.
So what are today's objectives, right? So why ethics? So once again, ethics really resonates with me because one of the reasons why I love medicine is the art and science of medicine. The science being there's so much material out there. The three major P's, patho, physio, pharmacology. There's so much esoteric knowledge you have to learn, like the more sciencey part. The art is that can you take all the knowledge and can you talk to someone who's not in medicine, talk to a layperson, and kind of work with them towards a common goal. So the art and the science. Ethics definitely being more the art part as well. So once again, today's objectives, we're going to go over the question. We're going to go over the side effects of lithium very, very quickly. We have a separate webinar just about lithium, so we're not going to go too much in detail today. We're going to go over the wrong answers of the ethics questions, and then we're going to go over the 4 principles of ethics. At the same time, I have a couple of resources that worked really well for me when I was studying for ethics, and I'll share them with you as well. So let's jump right in. So here's a question. Actually, Megan, do you want to take it away?
Oh, you're going to have me read this?
If not, I can totally do it.
Yeah, I can't do it on my screen. It's a little blown up smaller on my end. Sorry about that.
No worries, not to put you on the spot, right? So, like any question, the first thing you want to do, read the question stem. Which of the following is the most appropriate response to his patient's concerns, right? So, okay, cool. Most appropriate response. What do we have? We have a 26-year-old female presents to the clinic for follow-up with her husband. She was recently diagnosed with bipolar and has been taking lithium for the past 2 months. Okay. She denies any new symptoms, but feels that her previous symptoms haven't improved. That's fantastic. Her husband states that she's no longer experiencing decreased need for sleep, talkativeness, and distractibility when trying to accomplish the task. So far, everything's going well. The patient states she tries not to take any medications and is worried about the side effects. right? And then you read the question again, which of the following is the most appropriate response to his patient's concerns? So if I'm doing a question, before I even jump into answer choices, I take a couple of seconds and try to answer in my own head what is this question asking of me in my own words, right? So having looked at this question, what I would be thinking is a patient taking lithium, doing well. She's worried about side effects. What do I want to tell her? Right? And then try to answer in my own opinion. Well, if she's worried about side effects, what side effects is she worried about? Let's take a look at the answer choices. A, I will order some lab analysis right now, and you don't have to concern yourself with any new side effects. B, if you develop any new side effects, please make sure to make an appointment and come see me and we'll take care of it. Right? C, you're young and healthy, don't worry about it. D, please tell me what you know about the lithium side effects. Oh, that's something that I was thinking originally. And E, please read the paperwork and then it has everything you need to know. So more than likely, okay. So what do you guys think? Now, for those of you who did not answer or did not have a chance to answer on social media, we'll give you a minute. What do you guys think is the correct answer?
Okay. Well, for me personally, as my own opinion, I feel like E is not one of the things. So just here, go read this on your own and let me know what you think.
Go. Go on go on Facebook.
Basically.
Going on that, please don't get your medical information from Facebook. Just, I'm sorry, just please don't do that.
No, that's never good. Okay, well.
I'm gonna get so many angry emails.
Okay, so we have one person that has written in and said they think it's D.
Okay, fantastic.
Also, on social media, when people were responding last Thursday, a lot of people were saying either D or B.
B is in beta.
B is in beta. Sure. Yes.
Okay, so let's jump back. Remember how I about going to lithium? So lithium is a wonderful medication. Actually, hey Megan, do you mind muting yourself? There's a lot of feedback from.
Yeah, I just kind of picked up on that. I'll mute myself from now on.
Thank you. So lithium, is a medication used for bipolar. There are many side effects of lithium. So, for example, nausea, vomiting, muscular weakness, hypothyroidism, and the big one I can think of, nephrogenic diabetes insipidus, right? So the hypothyroidism and the nephrogenic diabetes insipidus are very valid side effects of lithium. So in this case, even though the patient is healthy, she has every right to kind of find out about side effects, right? So those are the side effects of lithium. So what's the correct answer? The correct answer is option D for Delta. Tell me what you know about lithium. What does it do? What are side effects? Why are you concerned? Why is option D correct? It's more the fact that you're trying to build a physician-patient relationship. So you have a healthy female, she's healthy now with ill health. She's taking medication and she has a very, very valid concern to her medication. Namely, I'm taking lithium, it's working for me. Should I take it long term? What kind of side effects will it do to me? So you want to build a relationship saying that, okay, everything is working well. You don't want to take it away. You don't want to make any rapid changes because of that. So you really want to have that open-ended conversation with the patient. So let's go through the wrong answer choices. How about wrong answer choice A, right? Let me order some lab results. Then you don't have to concern yourself with any side effects. So there's no clinical indication why you need to do a lab because of that. Because right now she's healthy, right? So why do you need to do lab analysis, which she doesn't really need to do so? Although further workup and intervention might be viable later on, in this case, she really doesn't need lab analysis. She more needs the knowledge, the wisdom that you have just to talk to her. Okay. How about B? So B is definitely fair if she does develop new symptoms. However, if you tell her, hey, if you develop new symptoms, come talk to me, you're just making her paranoid, right? Like, oh my gosh, what if I lose a couple of strands of hair? Oh my gosh, I have GERD. Is that secondary to lithium? Oh my gosh, I have no idea. Right? So B is not the best answer because you're not really alleviating her concerns. Right? So B is not correct. Option C, you're young, you're healthy, don't worry about it. Very dismissive, right? Saying that you have these concerns, I'm just dismissing your concern completely. Not really good management. I would not recommend C. And how about option E? Please read the pamphlet that came with the lithium medication. I completely agree with Megan about that. Very dismissive. The patient came to see you. She didn't need a pamphlet. She didn't need to go on Google. She wanted to see you and have you alleviate her response. Right. So option E, yes, we'll probably give them information. Yes, we might print something out from up to date and give it to them. But at the end of the day, the best teacher is you. Right. So once again, option D is the best answer for this one. So going back, when I was studying for ethics, these are 4 core principles that were drilled into me. So they're in their first day, they're in Kaplan, they're on YouTube. But let's go through them really quickly. Right? The 4 core principles. Once we go through these, I'm going to give you another case and kind of demonstrate how these don't quite fit into other questions, but these are really good guidings and moral guidelines. Right? So 1, autonomy. Treat the patient as an individual. Respect them. Respect their own personal physical health, respect their mental health, respect their ability to be private, and respect them to be truthful. Okay? Does it always happen in real life? Absolutely not. Right? And there are many kind of gray areas. But for now, treat the patient that they have the right to manage their own health, manage their own mental, physical, spiritual health. You are there to guide them. You can't force your own wishes upon them. You're more there to guide for them. Beneficence. Act in the best interest of the patient and advocate for them. So sometimes the patient might not know what's best for them, so you need to kind of work with them for their best health. Here's where your knowledge, your education, your ability to kind of convey what you think is best for them comes into play. Right? What's in the best interest of the patient? But this kind of goes hand in hand with non-maleficence. Do no harm. You want to avoid causing injury or suffering, but sometimes you might have to. And the example that I give, amputation of a limb. If a patient is diabetic, severely diabetic, and they have a necrotic left foot, right? Noticing it becomes gangrenous. What do you have to do? Well, we need to, right? Is that in the best interest of the patient? Absolutely. Are you harming the patient? Kind of, right? You're kind of causing the quality of life to go down, but at the same time, you're saving the patient's life long term. So kind of a juggle between the two. Right? And 4, treat the patients fairly. Right? It doesn't matter if they're invalid, they cannot pay. It doesn't matter if they're racist, they're not giving you the time of day. If they're being unpleasant, doesn't matter. You're the doctor, right? At the end of the day, you're the doctor. Treat the patient, do what you can to help them as best as you can. So these are 4 ethical principles. Ignoring the MBME, ignoring step 1, ignoring all that, I think these are just good core ethical principles, no matter who you are. Right? But I'll get off
really
my
are.
soapbox. Yeah, get off my soapbox. We'll continue. So let's look at this question really quickly. Right? This was the actual question that I saw during one of my exams. I don't remember if it was step 1, 2, 3, or MBME. A very similar question during my exams. It could be a QBank as well. So going back, what is the most appropriate response? Oh, I'm sorry. I didn't give answer choices because a lot of ethical questions, there's no right or wrong. There are many shades of gray. So I didn't include it for 2 reasons. One, I didn't want to give you the chance to think about it. And also, I don't remember the answer choices that I had. So what's the most appropriate response? We have a 14-year-old female brought to the physician by her mother for a physical exam required for summer camp. The mother leaves the room and the patient says, "Could you give me a prescription for birth control? My 16-year-old boyfriend 16-year-old boyfriend and I are sexually active. Please don't tell my mom. Physical exam demonstrates no abnormalities, and the patient has reached appropriate developmental milestones. So what's the most appropriate response? Right? So going back to the 4 core ethical principles, this is really tied into it. Yes, you're treating the patient, autonomously. Treat them as an individual, absolutely. Respect their privacy, sure. But it's a balance between what's ethically correct and what's legally correct, right? So another reason why I think ethic questions are kind of tricky is that all of us have very different social and economic backgrounds, very different cultural and educational backgrounds. For a case of the MBME in step 1, there's one correct answer. In reality, it's kind of gray, right? But let's go back to your question. So what do you do? In my case, I believe I answered the question that the patient, she's 14 years old, she's healthy. She's mentally, physically healthy, and she is able to make decisions on her own. So she can decide the fact that, can I get a prescription? And the correct answer is yes. She can get a prescription for birth control. She can get treatment for STDs, and you do not have to involve her mother or her guardian, her legal guardian. You do not have to. But let's make it a little, I'm sorry?
So, sorry, in the comment section, we have somebody who asked, does this depend on any of the state rules of how you can answer this question?
Yeah, that's a fantastic question. And the best answer is that, think about the MBME in step 1, right? It's given to all 50 states across the world. So they cannot give a question that's, oh, it's correct in New York, but wrong in Florida. It's correct in Alaska, but wrong in California. So they won't ask you that level of detail. From a legal standpoint, yes, each state has their own laws and regulations. But for the MBME in step 1, I don't want you to overthink it. But it's kind of blanket statement is either yes or no. That's actually a great question. So did I answer that, Megan? Hopefully yes, no?
Yes,
So
you did.
Okay, for MBME is step 1, it won't be that difficult, basically. Yeah, okay. So cool. So let's take the same question and let's make it a little bit more challenging. What if your boyfriend is 22 years old? Okay, so she is a minor. Her boyfriend is 22, so above, I think 18 or 21 is the age of consent. Once again, depends on state, right? But let's say her boyfriend is above the legal age of consent. She is below at 14. Now what do you do? Okay. Let's make it even more challenging. What if 14-year-old female has Down syndrome or some kind of mental incapacitation to give that kind of consent? So what if she is a minor? She has some kind of neurological dysfunction, maybe it's Downs, maybe it's trauma, maybe something else. Is she fully aware of her consequences? What do you do? And then this question, what if both parties were mentally challenged? So this was the question I saw in one of my exams or Q banks. And the worst part was that there was no answer key. So I don't know what's the correct answer. I was reviewing this PowerPoint earlier today. I was really trying to remember. I tried to Google it, try to look it up. I don't have an answer. But hopefully, for those of you watching, those of you playing along, what would you do? Right? Because I honestly don't know. I vaguely remember looking at the ethics board, which is something that you never really want to do, like consulting a third party. Like you never want to punt to another party. In this case, I had absolutely no idea because both of them were underage. Both of them were mentally challenged. I could argue for both. I mean, I could argue for either case. So I took a calculated gamble. Let's talk to the ethical board, see what they have to recommend. Okay. So, sorry, very unsatisfying answer for all of you. But so what do you do, right? So when I was studying for ethics, once again, ethics to me can be very tricky and very challenging. And I think it's actually designed that way because on the MBME, on the step 1, being confident goes a huge, huge way. You don't want to be thinking about question 2 if you're on question 5, right? You want to click and move. I'm sure you heard that before, click and move. So ethics is one of those things that, oh my gosh, should I call the ethics board? Should I talk to a mother? Should I make a phone call? You don't want to do that. So a little bit of test strategy, just click and move on. But going back, so when I was studying ethics, here are the things that I use. So you will have some really good ethics questions and a really good breakdown. First aid has those rules and guidelines. AMBOSS has them as well. AMBOSS has a couple of questions which are really, really good as well. Dr. Fisher, I'm sorry if left out the doctor. Dr. Fisher has a great book on ethics. I think about 100 cases of ethics. Really, really good read. Shouldn't take you more than a couple hours to go through. Right? This is something I pulled from Reddit. And one attending actually used this when they were doing ethics questions. In general, don't consult the ethics committee. So I probably got the question wrong, right? Don't, because I didn't know. Don't consult the ethics committee. Don't pull a Roland. Never be rude to the patient or be abrupt with colleagues. I think that goes for common sense. Don't be rude. Don't be a jerk. Okay? As for the patient's feelings and input. So once again, ignoring what we're doing now, I think it's really critical because you're trying to build a patient-physician relationship. And ignoring that, I think just asking them, because you're on the same team, you want to help them improve the quality of life, right? So ask them, what do you want? What do you want? What are your goals? What are your objectives? How can I help you reach them? Instead of you trying to fix every single one of the issues, right? So they're not a puzzle to be sorted out. They're a human being, basically. Also imagine yourself actually saying each line to a patient. Would you say that in real life? This one actually worked wonders for me when I applied for step 3. Would I actually use that exact terms talking to a real patient? If I have a physician talking to my parents, well, I want them using that kind of tone with my parents as well, right? So basically, a golden rule, treat like you want to be treated. Right? These 3 are 3 things that I use for my personal moral compass. So once again, I'm gonna jump on my proverbial soapbox. Be kind, be nice to each other, but don't get taken advantage of. It's really easy that for someone to think, oh, they're kind, can I get more? Oh, can you help me with that? Can you help me with that? So be kind, don't get taken advantage of. Be informative. So give the patients the information they're seeking. Tell them the information, but read the room. What I mean by that, don't overshare. Right? You don't want to really scare them. You don't want to overshare the information because knowledge can be used in inappropriate ways. So read the room. What are you trying to do with that information? Oversharing can be very dangerous as well. And 3, be open-minded. The patient can tell you stuff that you might not agree with, things they might not heard of, things that you might find extremely funny, right? But at the same time, you need to take it with a grain of salt. So have your own moral compass. So even though you hear something doesn't quite jive with what you believe in, have your own moral compass, but be able to deviate when necessary. Okay. So that's my 2 cents. So Miss Megan has been working with me for the past 4 or 5 months. I think it'll be
I think we started on Christmas was our first one. So
5-month anniversary.
wow.
I've taken the liberty to have 3 relatively challenging questions that I figured Megan can teach all of you guys. So Megan, are you ready?
Oh goodness.
Ready?
Sure, let's try this.
Let's try it.
Is it the mitochondria? Is the powerhouse? Okay. You're funny. Half of you fools are rolling.
So happy Thursday. Thank you to everyone watching. Huge thank you to Megan for putting up with me and my antics. But
always.
This prevents making me do a spotlight. So.
Yeah, check out our spotlight on our St. James School of Medicine website. It has a little blog post of our amazing Dr. Rowan Singh and his journey throughout his medical career so far, finishing up with him matching. So it's a great read.
Out of the box, huh? How to kind of throw me into the world. So,
of course.
Once again, a huge thank you for everyone playing along. Once again, I think ethics is a really good way to pull out a lot of points. At the same time, a really easy way for the MBME and step 1 to trip you up. So please don't ignore ethics questions. I think it makes you a better human being. So, on that
It
note,
does
Miss
for
Megan,
sure.
thank you.
Of course, thank you so much. Thank you everybody for joining in this week and last week when we had posted the question. We will see you next Thursday with a new question, and then that following Thursday with our live USMLE wrap-up session. So thank you all and have a great day, great weekend.
Take care.
Bye,
Thank you.
everyone.